But they're here. I want to give you some, read you some
No,
facts.
they'll never take us under, because we're bringing truth like thunder, raining on your speakers like a ton of bricks.
Dr. Alan Way, I want to get into a Catholic question here. I'm going to insert a moral question with your medical expertise and your Catholic faith as well. The COVID-19 vaccine has created a moral controversy amongst Catholics across the country. In fact, the 2005 Pontifical Council for Life stated that if an infectious disease was grave and if a morally illicit vaccine was not available, then it was morally permissible for a Catholic to accept a vaccine or medicine that was derived or used with a morally illicit cell derived from an abortion. We hear that aborted fetal cells, specifically one called the HEK 293 cell line, they were used in some fashion in the vaccine design or in the testing or in the manufacturing. So I have a two-part question for you. Number one, are there any Operation Warp Speed vaccines that did not use aborted fetal cells? And number two, are there any alternative vaccines or treatments to deal with COVID-19 that are free of any ethical controversy for people of faith?
Doctor, before you answer that question, we got to take a quick break. This is what we call a cliffhanger.
These are the questions that Catholics want to know. Let me repeat my question for those that are just tuning in right now. So, Dr. Allen, the COVID-19 vaccine has created a moral controversy amongst Catholics, and the 2005 Pontifical Council for Life, they stated that if an infectious disease was grave and if a morally illicit vaccine was not available, then it's morally permissible for a Catholic to accept the vaccine or medicine that was derived or used with a morally illicit cell derived from an abortion. We hear that aborted fetal cells, specifically one called the HEK 293 cell line, were used in some fashion in some vaccine design or testing or manufacturing. So my two-part question is, number one, are there any Operation Warp Speed vaccines that did not use aborted fetal cells? And number two, are there any alternative vaccines or treatments to deal with COVID-19 that are free of ethical controversy?
So, unfortunately, there were to my knowledge, eight Operation Warp Speed vaccines, and only one of them, which is through manufactured for Sanofi, which is still in clinical trial. We don't have enough information on whether they used the HEK 293 in their testing phase, but all of the other and Merck actually got out of the vaccine race, but the remaining ones, all of them are using the HEK 293 to some extent, some worse than others. So Johnson & Johnson and AstraZeneca are using an aborted fetal cell line like the 293 in the manufacturing, and the remaining are using the 293 in the testing phase. So there are what they call relative moral illicit vaccines here. To the second part of your question, and just to add that the 293 is ubiquitous in medical research. It's used in everything. It's used if you're a cystic fibrosis patient, you have a drug that's using the 293. If you're a hemophiliac, you're using the 293. If you need gene therapy, you're using the 293. If you're doing any kind of viral work, if you're a medical researcher doing any type of viral work, most likely you're using the 293. So it's in everywhere. To your second part of the question, there are treatments that are not vaccines that are available for patients who are high risk. And this is the controversial hydroxychloroquine that people were complaining because President Trump had mentioned it. Yeah. So what some scientists and experts say, well, hydroxychloroquine doesn't work. or it is unsafe. It causes cardiac arrhythmias. Well, the truth of the matter is hydroxychloroquine is not going to be effective if you have a severe enough COVID infection and you're in the hospital. At that point, it won't work. Second is that where it works is in the early stages, in the ambulatory setting. If you have a high-risk patient, like someone who's elderly, over 65, or with comorbidities, hypertension, lung disease, heart disease, diabetes, or obesity, if it is administered early enough, within 7 days of the onset of symptoms, it will have a pretty good track record of reducing the morbidity, mortality, reducing the risk of hospitalization, and reducing viral transmission. And that is also true with another drug called ivermectin, which is used for treating parasites. So these two drugs, in combination with zinc and antibiotics, either azithromycin or doxycycline, have shown in high-risk patients given early can reduce hospitalization, mortality, and viral transmission. So in that situation, there's actually a treatment that you can take if you are in that high-risk group. Unfortunately, hydroxychloroquine is only administered by 20% of practicing physicians. It's available in many states, but not in states that are typically blue political states. And so what you probably have to do, should do, is that if you're one of those high-risk patients, you should have a conversation with your doctor and ask them, if you come down with COVID, will he or she prescribe that drug cocktail or not?
Great question. Great question. Here's my next question. I know we're running out of time, but so much. Doctor, many in the Catholic hierarchy are urging everyone to get vaccinated based on the argument, I hear it all the time, that it's necessary to prevent the viral transmission to vulnerable groups like the elderly. The arguments are being couched in terms of compassion and moral duty and charity. But from a scientific perspective, is there a scientific basis that the vaccine will prevent viral transmission? And is this argument justified? Big question.
So that argument is plain erroneous. These vaccines do not prevent viral transmission. Vaccines only work by reducing the severity of the viral illness in the person who gets vaccinated. So it is fallacious for anyone to say it is the duty for young people to take the vaccine just to protect the elderly and those with chronic disease or high risk. I would not want to see my children or anyone else's children or grandchildren have to be vaccinated and be put at risk just because to try to protect me when that won't happen anyway.
Thank you.
Doctor, so we hear that there are new viral strains coming from the UK, Brazil, and South Africa, Will the current vaccines and the standard of care be effective as a strain that originated from Wuhan, China? What are your thoughts?
So we don't have a lot of peer review research to be able to answer that. What we only have right now is the press releases from these companies. Mm-hmm. And what we're hearing right now is that the current Wuhan vaccine has some effectiveness against the UK strain, but it may not be as good or effective against the South African strain, and we don't have any information about Brazil. And this is a problem with these vaccine methods that are based on what I call the subunit approach, that is specifically targeting the spike protein, because the spike protein is constantly mutating and it's basically trying to chasing your tail all the time. is that you're try to keep up as the spike protein is mutating in real time.
Doctor, we only have a couple minutes left, but I want to make sure people can go to a website, and I hope to have you back on a regular basis myself. Hey, question. We want to know that your institute is, we know that you're working on a vaccine or a treatment for the COVID-19, but for our audience, can you provide an assurance that your research program is not using the HEK 293 cell line that we hear so much about that was derived from aborted fetuses in the 1970s? I want to hear don't give me any political answer. I want to know, are you doing it or not?
No, we're not.
Good.
So our cell line, we've made a specialized cell line that is derived from a stem cell from cord blood. And essentially, we have been able to in-house develop this technology in-house. It will be free of aborted fetal cells, both in design, manufacturing, and testing.
Awesome. Yes.
So in simple terms, can you explain how your research program differentiates scientifically from the Operation Warp Speed, and at what stage is your vaccine in development, and when do you anticipate it's going to be ready for clinical use or clinical testing?
So our vaccines are still in preclinical development. So this is the frequently asked question we get because people are concerned, Catholics are concerned about taking these current vaccines, but because they have been tainted with the 293 cell line. And so we tell people that it's not ready for prime time. We still have to it's still in preclinical development, and it would be at best case a year and a half before this could be available for clinical trials. Now that said, that sounds long time from now, but the reality is the pharmaceutical companies, along with the government, they are predicting that these vaccines and the need for ongoing COVID-19 vaccines are going to continue in the future. So this issue, both scientifically and morally, is not going to go away. So what's different about our approach is that, number one, we are making a attenuated live vaccine. So we think that is a better approach, a more traditional approach. And the other is we are making a subunit approach, but it is not based and restricted to just relying on the spike protein. So those are two different innovations that are not been part of Operation Warp Speed.
Doc, I just want to say this because we got to end. We are glad to partner with you and the John Paul II Medical Institute to expose the truth about COVID-19. And Jess, are you with me, brother? We'd love to have him back, man.
Absolutely. He's going to be very relevant.
Yeah, just giving us updates. Yeah.
Yep.
Sure. I appreciate you letting me opportunity to speak.
Are you kidding me? We're happy that you're willing to take it on the chin for Jesus. That's what I say, because this truth is what sets us free in all aspects of our life. Thanks again from the Dr. Alan Moy from the John Paul II Medical Institute. Listen to this, Doc. This is how we end every show. You'll remember. Jess, what state should we be living in, brother?
Live in a state of grace. Don't live in a state of mortal sin. And remember, life is short, eternity's forever. Terry, take it away.
God bless you. Dr. Alan Moy from the John Paul II Medical Institute will have you on again and again to keep us informed on this important topic. I want to ask everybody to continue to pray for the John Paul II Medical Institute, because they've got big work ahead of them, and they need your prayers as we need your prayers also. May God richly bless all of our listeners, and take this out, get this word out on social media. God love you.